Okay, cool. Well, Dr. Sara, thank you for coming on the Super Life podcast. We're going to talk about something very interesting, certainly for me. But, the pelvic floor. And why I'm also interested in this is because it obviously affects us.
Right.
Affects all of it. And it's one of those things that, and just kind of going through your book, you realize how, and I am aware of it on the guy's side, on the prostate side, on many of the similarities, but also there's a lot more complexity essentially to a woman, but in that area. But I'm interested on many different levels, physical levels, the sexual health levels, the suffering that's happening. I mean, 1 in 3 women.
Yeah, I actually think that that's an underestimation as well. I think that a lot of these pelvic health issues, which we'll dive into, go unreported. I don't think that, medical providers are screening for them. I think if women in particular experience them, they think that they're normal, or they're too ashamed to talk about them, or they don't even know where to get help. Right.
Yeah, and that's the interesting psychosomatic, not really, we'll get into the psychosomatic, but it really the cultural shame around it, and how easy it is to silo this for yourself, and not, it's like, where do you talk about it?
Well, I talk about it all day.
Yeah, you have.
But, I do think it's interesting because a question I get asked by patients and by other people like yourself are, why aren't we talking about this more? Why don't we know more about it? And I think it really starts from when, women are young, when we start getting our periods. And I talk about this in the book about how you're, slipping tampons up your shirt sleeves, or you miss school when you're on your period because you're afraid you're going to bleed, or you're in pain, or, even sex. We maybe get a little bit of sex ed. We maybe get a little bit of period education. But we don't talk about our pelvic floors, which every woman has, every body has, and women are so much more susceptible to problems in this area.
Yeah, it's and even when you say in the book, it's like we have all these slang terms for that area, and it's the undertow of that, pun intended, I guess, is that inherently the fine print is we're not comfortable with it.
Right.
Why aren't we okay with saying vagina?
Right.
Or it's weird.
It is weird. And, I'm raising 2 young boys now. And even for them, we'll talk about hey, this is your scrotum, this is your testicles. And, they're like, but my friends call them nuts, And so I'm just like, but if we don't teach children the proper anatomical terms, oftentimes we don't even know them. I mean, I think most women don't even know the difference between a vulva and a vagina because we just use those terms so interchangeably. But again, it all comes back to just education, information, and I really should be trickled in when we're younger.
Yeah.
And then I think we're more aware of how to talk about problems and address them when, we get to stages like pregnancy or postpartum or perimenopause, because we just have more awareness about this part of our body.
Yeah, because it can affect so many different aspects to it, and all of it are very intimate.
Yeah.
From peeing inadvertently, or I didn't realize women could be getting up 6, I thought it was just guys with prostate issues, but women getting up 6 to 8 times a night, and then worried about the example you have of going for a hike, and I'm gonna purposely dehydrate myself, so it gets itself into a lot of different things, from constipation to painful sex to all kinds of stuff.
It does. And I think, the way I kind of broke the book down was just by systems. Let's talk about bladder health and peeing and leakage, and let's talk about pooping and constipation and bowel movements, and then pain, and painful sex. 1 in 4 women will experience painful sex at some point in their lifetime. Again, I think an underestimation. But then I go into stages, why is your pelvic floor really important during pregnancy, and what can you do to prevent issues? But I think one of the things that I see a lot in my clinical practice over 18 years is how much this affects people's lives, whether it's pain with sex that, decreases intimacy with their partner, and then that can lead to marital or relationship struggles, or not even being able to have sex and you can't start a family because you can't get pregnant. Or to your point about leakage, where, we all know the health benefits of exercise, but if somebody is literally peeing their pants in a workout class or a run, how are they supposed to do these other aspects that are so beneficial for their health? And it's this underlying, to your point, this undertow of things we're not talking about, but they're so impactful on our day-to-day lives.
Yeah, and it's that, below the belly button.
Yeah.
And it's inherently, when you look at the anatomy, like I have a physiology I wanted to be a PT for a split second.
You went a great route, don't worry.
Yeah. But I did, I kind of went there, did a lot of physiology stuff, a lot of exercise therapy, a lot of things like that. And the body's just amazing.
It's fascinating to
me.
me.
It's crazy. But then when you look at, because I haven't looked at this as much, but when you look at how the ligaments, the tendons, the muscular structure, what its job is, and if that gets weak,
right,
or if that, then we got to talk about the somatic side of things and the perpetuation of emotions around it, and that's almost a snowball effect.
Totally,
and so we don't understand how important this area of the body we work out, but we think of working out as our biceps and our thighs and our ass.
What we can see.
Exactly. But this is but then you have things, and we'll get into that, like what kind of things that we can do. So why don't you just describe best that you can, obviously video and auditory, but describe from your perspective what this pelvic floor is.
So we're all used to seeing these, the pelvis, the bony pelvis. You maybe see it on a skeleton model in the doctor's office, or those jammies that your kids wear, something like that. But those are a ring of bones that attach in the front with a ligament at the pubic bone, in the back at your sacrum. But at the very bottom of that ring of bones is a basket of muscles. And imagine it like a hammock that attaches from the front to the back, side to side. And it's muscles, it's nerves, it's tissues, but it supports your pelvic organs. So in the female body, it holds the uterus, which holds a growing baby during pregnancy, the ovaries, the bladder, which holds urine, the bowels, which hold stool. And then in the male body, it has no uterus, but it has the prostate. So this hammock is supporting those organs all throughout the day. It actually connects to your core, so it connects to your low back muscles, it connects to your deep ab muscles, your transverse abdominals. So it supports your core, it supports your spine, it moves when we breathe. So every breath we take, that pelvic floor is contracting and relaxing. And this muscle in the female body also has 3 openings. One for the urethra where urine exits, one for the anal opening where poop exits, and then the vaginal opening for menstruation, vaginal intercourse, and vaginal birth. So to your point about this muscle does so much. Every day we're using it over and over again, and we don't even know it exists. I think most medical providers, most physicians don't get any of this education in their anatomy classes, let alone how do you screen a patient for it, or how do we educate patients on it proactively. So it's super important. In the male body, we see there's 2 openings instead of 3 because there's no vagina. But it's, every time we pee and poop, it's working. Every time we breathe, it's activating. Every time we lift weights, it's turning on to activate our core. So again, super important. But when things go awry is really when we start to see people suffering silently. And this is kind of where pelvic floor therapy comes in.
Yeah. What do you think the top initiators of this kind of almost an epidemic is happening? Why are all these issues, why do they come about from the modern day world, and how we're sitting, how we're not taking care of the body? It was fascinating too, like body position, and obviously then you have breathing stuff in here and the diaphragmatic understanding. So it's and like you said, it's such a almost the OG of the core.
I love that.
Right?
Yes.
It's like that's the core that we're truly talking about.
Right.
And then if we override that and actually don't acknowledge that, we can potentially even cause it more harm.
Right. And I think so, to your point, some of the biggest things that I think bring women in to seek pelvic floor care are urinary leakage, hands down. By the age of 65, 1 in 2 women, 50% of women are leaking urine.
Wow.
I mean, that's not a great stat. And
Just normally throughout the day?
Just normally throughout the day. It could be with a laugh or a cough. It could be so severe they're wearing Depends and diapers. So, and this is, if you go to the grocery store, there's an entire aisle of incontinence products. Right. I mean, this is a multi-billion-dollar industry. And we have medications, we have pads, we have, surgeries. But again, we're not talking about just the basic exercise of how to take care of this part of your body. I would say another big one is painful sex. We talked about that one. It can really affect women at any age, from the first time that they have sexual activity to after birth to in menopause when your hormones are changing. And then another major one is, actually we don't talk about it a lot, but it's called diastasis recti, which is when you have a stretching of the core muscles. We see this in male bodies as well, female bodies, but we're not really educating people on how to breathe properly when they're working out. So they're holding their breath and straining, and that can lead to a weak core, especially after pregnancy and birth. I think one of the interesting things, though, is that not just what the issues are, but we're not really told how to fix them. I think oftentimes the narrative has been for women that this is just a normal part of being a woman, normal part of being a mom, normal part of aging. So we've accepted these inconveniences as just kind of part of life, when yet there are so many things that can really help.
Yeah, it's the same. It's kind of the same old deal. The healthcare system, the way that the healthcare system kind of fails us in the presenting healthcare system, I guess it were, right? Yeah. It's like, okay, we have a bunch of products here to help handle what's going on, but again, not getting to the root cause.
That is exactly right. And, I think that's where I really shifted in my career about 10 years ago. I've been practicing for 18 years. This is the only type of physical therapy I've done. And about 10 years ago, I started seeing a lot of women come into the hospital where I was working to get physical therapy for these mesh surgeries. They were experiencing pelvic organ prolapse, where their pelvic organs were falling into their vagina. They were getting them surgically repaired. And the FDA had approved this mesh to surgically implant into women, and the mesh started disintegrating, causing infections, severe pain. I mean, threads of this mesh coming out through their vaginas. Their husbands were feeling it during sexual activity. I mean, it was awful. And I'm going, these women's lives are ruined. And they should have never even needed this surgery in the first place. Right. And I said, I don't want to spend the next however many years of my career just doing damage control, because there's so much we can do to even prevent it from getting to this point. And that's when I really started. That's when I started the Vagina Whisperer Instagram account and saying, we need to start educating women about this part of their body, because they should not have to suffer this way, and it shouldn't get to that point. We shouldn't be just treating symptoms. We need to get to the root of what's going on and even prevent those things from happening.
Do you think, what do you think the modern day world, and why, what are some of the top reasons why you think it's happening?
I would say now everything is pretty over medicalized. Something like birth, where we just intervene. Totally. We have over inductions. We have too many C-sections. We are getting women out of the hospital within 24 hours and sending them home with no prenatal care or postpartum care. I would say that we are quick to treat things with medicine and surgery and procedures versus looking at the benefits of eating well so that you're not constipated. Physical activity, because we're all sitting too long throughout the day. I mean, you and I just talked about our drives here, and it's like, if you're doing that on a daily basis, I always say sitting's the new smoking, the stress of our lives. I think that we're not getting enough of those just basic foundational things like nutrition, socialization, sunshine, exercise, hydration. It's just, everything is so convenient and fast paced that it affects simple things like what we're eating, what we're drinking, how much we're moving. One of the funniest things is that, women tend to do what's called power peeing, which I don't know if you're aware of this, but we go to the bathroom as quickly and efficiently as possible. We push our pee out because we want to be in and out, or we've got, somewhere to be. And that is the wrong thing for your pelvic floor. That's going to weaken it over time. That's going to cause leakage or prolapse. But we don't know this. We're just trying to be really efficient in how we pee. And I'm like, girl, sit down, take a breath, and just pee. Like, just
Right.
do one simple thing the way it's supposed to be done instead of rushing as quickly as possible.
Yeah, it kind of goes to the whole society itself. Like we
Right.
just bull rush all of this stuff that we've naturally been doing since we've been mammals,
Right.
And then somehow we've got into this place where we've overridden these basic things. And it's like, isn't that kind of like scratch your head moment where it's like this is the most, to this point, the most basic
Right.
of all things, how to control, how to nurture, how to slow down. It's our society, number one, I think, is completely flipped, and it's hard for women in that way, because it's just I guess as guys, it's detrimental for us too in the fast-paced world.
Yeah.
But there's not a restful, nurturing space much at all in our culture,
Correct.
right?
Right. And I think for women in particular, when we look at things like giving birth or having postpartum recovery or, or having painful periods. I mean, 1 in 10 women have a disease called endometriosis, which causes them to miss school, to miss work for this pain. And it takes them 7 to 8 years to get a diagnosis. And so the impacts of these things are so big, and they're happening every day in our workplaces, in our schools, in our communities. But it's just still kind of being shuffled around and swept under the rug, or we've just learned how to deal with it as women. I do think that we're frustrated. I think that we are hoping and demanding more support. Things like, better health care and education, but also things from a society like paid parental leave. I mean, I had 12 weeks off. My husband had 2.
Right.
And he traveled for work. And so I had a 2-week-old baby in a town with no family, and he was back on the road and I was by myself.
Right.
And I was like, this is awful.
Yeah.
So we're just really not giving that rest and that nurture that I think women need, that families need. I think that our healthcare system is just not providing from a societal structure and a kind of a medical background. It's just like, how do we go in and out and just keep going?
Because it seemed like when you were in your PT study, and as soon as that pelvic floor that seemed to just stick for you in terms of like,
it did.
What was that moment, and why do you think that was so powerful for you?
So 20 years ago, I mean, I feel like a dinosaur in this pelvic floor therapy world now, but or maybe I'm a pioneer,
Yeah.
but I had a professor who just taught us 2 small weeks of the pelvic floor. And I'm going, I have never heard of these muscles. I mean, we've taken cadaver lab, we've,
Right.
had months on the hip and the shoulder, but we've never talked about the pelvic floor. And as a woman, I was like, this is really fascinating to just understand my body better. I mean, to your point earlier, our body kind of just works in this really fascinating way that we don't even really understand. And once we do, I'm like, this is just incredible. And then I did a clinical rotation, working with patients in pelvic health, males and females, and to help people with issues that they didn't even know there was help for, that were so impactful on their quality of life. It just was like, this is the type of therapy I want to do. I mean, it completely changed their lives. I mean, from a young woman feeling like her body was broken because she couldn't have sex, to helping a woman who, was trying to get pregnant, but sex was so painful. And then you see her in the grocery store 6 months later and she's pregnant and starting her family. I mean, or, an older woman who was going to end up in a nursing home because her incontinence was so bad and she was leaking and rushing to the bathroom multiple times at night and had a fall. And now she's able to stay home in her house and continue to socialize. I mean, it's just, these are the things that I think are kind of the underbelly that really affect how women live their lives. And I loved it. And I always say, like, looking at a vagina, working with the pelvic floor is like working with an elbow. It's just another part of the body for me.
Yeah. But, it's a silent, huge problem.
Yeah.
And that's what's alarming. That's why I want to have this conversation, because it's like, it's when you look at this stuff, like, that's the beautiful thing. When you actually don't just blow this off, because they also, in my anatomy, kinesiology, I felt like I could learn the Latin names
Right.
and I could understand mechanisms of action and all that stuff, and it was fun. But no one talked about
Nothing. We
Like-
kind of skip from like the ribs to the knees, and then we just keep going, you know?
Totally, yeah.
And so I even think in fitness, you know, and we're educating people on how to lift heavy and how to move, but it's like, are they contracting their pelvic floor? Are they relaxing their pelvic floor? Are they breathing properly so they're not giving themselves prolapse or hemorrhoids or diastasis? So it's, you know, when I see these things, it's kind of like that's what I look for. I'm not looking at like their ankle mobility or their knee. I'm thinking like how, just the basics. Are they breathing? How are they lifting? Are they, you know, there are these videos that go viral on women lifting heavy weights and they're peeing their pants on the gym floor and people are clapping. And I'm like, listen, if that is how you want to do it and that is powerful for you, like go for it. But I do want you to just be aware that this is what's going to happen to your body over time. And, you know, it's going to require surgery, and just be aware of the impact of those things in the long term.
Are you saying that there's people out there that are pushing so hard that they're actually praising that they're
100%.
peeing as a result?
100%.
They're working so hard, you're peeing yourself.
Yeah. That they're just bladder contents are on the floor of the gym and people are clapping, and these videos go viral all the time. And I mean, these women are strong and amazing and powerful, but I always say, like, your body is telling you something. If it's pain or leakage or pressure, these are pieces of information that we need to listen to. And so I just kind of encourage that. I always say I want to encourage these conversations. I want to normalize the conversations. I don't want to normalize the problems.
Yeah, no kidding. I mean, so like, let's kind of walk through it. Like, so, okay, so you're 12, 13-year-old,
Yeah.
you're getting your period. It's largely like, it's so weird.
Yeah, I mean,
Right?
I think every woman remembers the
It
day.
it's gotta be, and I'm only obviously from a distance here, but it's got to be so, you're a child. Next
Yeah.
thing you know, you have boobs,
Yeah.
you have bleeding happen. You're going, what is
Body
going?
hair, right?
Yeah,
right.
it is an absolute weird situation.
Right.
And then if the culture itself kind of doubles down on it's not really acceptable, don't show it,
Don't talk about it.
Don't talk about it. And then the parents, what are messages theirs? Do they have shame?
Right.
And what are they projecting? And so then this cycle happens. So now I've internalized the kind of one of the first big events. And then talk me through like what happens then? Why do you think that this is happening? Why is it all of those things? Is it us sitting? Is it us stressed? Is it our poor? I'm probably answering myself, right? Yeah. But because it's a change. I was going to say death, but it's not death. But it's a change by 1,000 cuts.
Yeah.
And next thing you know, you're sitting here. You have a flourishing career for 20 years. You probably could have a waiting list for the rest of your life, right? Because a lot of women
Right.
are suffering something.
Yes.
And if they don't do something about, maybe it's starting with a little pee here and there, maybe it's starting with a little sexual pain, maybe it's starting with a little constipation, and they sit with that
Right.
for years, when in fact their pelvic floor is getting weaker and weaker and weaker and weaker and weaker, and then they're continuing these bad habits.
Correct.
And next thing you know, they're in their 30s, they should be in their prime, and they're not having a good time.
Right.
There's a lot of issues.
Yeah.
And then couple that sprinting all the way towards menopause and having children and menopause. Like, there's a lot of activity
Right.
that is undermined by our modern life.
Yeah.
So it's not a reductionist kind of answer either.
Right.
Right? It's not do this and but that's the medical model. They just
Right.
want to go, okay, if you literally damage yourself acutely, okay, then we can respond to that.
Yeah.
But we don't have to wait for that.
Correct. You know, it's you pretty much answered everything, but it's one of those things where I think one of the reasons that young women are entering a stage in their life where they are in the dark about their bodies is because we were in the dark about our bodies. Mm-hmm. We came from a generation of parents, not to their fault, where you didn't ask questions, you didn't talk about, you know, your bodies. And you know, I'm Asian, so in that culture, there's no conversation. You know, there's like a book and a box of tampons.
That's
and it's
even
like,
worse.
Let me know if you have questions. And there's nothing. There's no sexual education, anything. And I think a lot of those cultures, especially with the melting pot that is America, you know, that's how we are kind of educated or not educated. Right. It's really shameful. I mean, there are religions where you're not able to enter the religious institution when you're on your period. You can't even sleep in the same room as your husband. Right. You know, and these are very acceptable practices. But again, I think it starts educating and kind of creating this narrative for young women that there is this part of your body should be hidden. There's shame associated with it, and that really the only thing it's for is sex, which is not the case.
Right.
And so when I think about for a young woman, it's, you know, one of the more popular videos I have is how to insert a tampon. But I have mom friends that are sending this to their teenage and, you know, prepubescent daughters or, you know, daughters going through puberty because they don't know how to insert the tampon. You know, they're like, well, what's the angle? Or do I do it on their period or when they're not on the period? And, you know, so just we're learning as a generation so that we can help teach the next generation to have more information. So everything from how we're educating women about their periods, that periods shouldn't be painful, that's a red flag for endometriosis later in life. That is one of the number one indicators for endometriosis is a painful period as a teenager. You know, different things like sex, where a lot of women are often taught that sex is, you know, off limits or that it's not culturally or religiously acceptable. But then you get married, flip a switch, and all of a sudden it's fine. I'm like, they don't even understand this part of their body. Right. You know, they didn't even know that, like, pee and their vagina come out of two different holes, you know? I mean, It's like the basic education. So I think those things. And then, you know, I think for women, we know that in research, the 3 biggest risk factors for developing a pelvic floor problem are pregnancy, giving birth, and going through menopause. And 100% of women will go through menopause. So these are stages in life where I think we, as a healthcare system, need to be proactively supporting women because we know that they're going to develop problems afterwards, and yet we just want them to keep going, keep having kids, grow the population, get back to work, go through menopause, and take hormones. But there's just really no care for this part of your body. And I have women who don't want to have another kid because they're like, my pelvic floor can't take it anymore. I don't want to have that same childbirth experience. I don't want to have prolapse. I don't want to keep leaking. And so it really is affecting, I think, how people are making decisions in their lives. Or they stop working because their symptoms are so bad. Or they, you know, stop having sex because it's so painful when they become perimenopausal. So the ripples go really far when we don't proactively address the problems.
Well, that's from a guy's perspective. If women are in the dark about this stuff, I guarantee the guys have no idea, right? We're kind of A equals B. Like, you're going, what do you mean you don't have sex? And then we make it about us.
Yeah.
Or we project and it's about them. And it's like, and so there's this whole world that's existing that's causing a lot of issues for intimate relationships, for connection, for an unbelievable love-making opportunity between two people. But if you're literally the cultural is, again, probably using my words weirdly, but breeding an issue and not dealing with the issue and then using some weird-ass mesh that is going to, I mean, going into the body is like the last thing you want to do. Especially there.
I know. But it's often the first thing that happens, you know? It's like, oh, well, let's do therapy afterwards. You know, I'm like, no, do it first. Like if you you tear an ACL in your knee, you don't just get surgery and then never go to therapy. You get therapy beforehand. You get therapy in the hospital, literally the day that you get that surgery. And then you get therapy for 12 weeks after. Yeah. I'm like, you have a pelvic surgery or a hysterectomy or give birth, and like you're home. And that's it.
Right.
There's nothing. And to your point about sexual intimacy, you know, I think that it can cause friction, it can cause distance, but I also think it causes a lot of helplessness.
Yeah.
I mean, I get a lot of partners who reach out to me via social media or via, you know, the internet, and they're going, I just stumbled across you and I feel like my wife has this problem. Can you help us? Or my wife has pain and I feel terrible that she's experiencing this. I don't want her to be uncomfortable.
Right.
Like, what do we do?
Right.
And so I think it helps just empower all parties when both sides of a relationship get involved. I will say, we mentioned earlier a little bit about male pelvic health problems. And, you know, because males have a pelvic floor, they don't go through the same physical transformations of pregnancy and birth and menopause. But they often have, you know, frequent urination, difficulty with erections or orgasms, pain with sitting, constipation, and those are all pelvic floor related. But I'll say the number one thing that brings men into my office is sexual dysfunction. They can be having painful poops and hemorrhoids for a decade, but once it starts affecting their erections or their sexual health, they're like, I need help, you know?
Right,
And I'm like,
right.
well, we're 10 years in now, so let's wheel it back. But you know, it takes a lot of courage. You know, women do talk about their bodies more, but it does take a lot, I think, for a male to come in as well and seek help, not knowing that their pelvic floor could be a component.
I mean, you're talking about the symbolism of a man at that point, and then how closed off or shut down men typically are. It's gonna take a lot for them typically. But also it's encouraging, and I want to encourage all guys even listening now, it's like the fact that they are reaching out to you and seeing it's helpful that we see symptoms, because we want to support our women, like, period. That's inherent within us, right? So if we become more aware and we have more empathy, more understanding, but I love the fact that they reach out because they want to do something about it, right?
Right, problem solvers.
Yeah. But so let's talk about that, because how number one, how encouraged are you that through good pelvic work, and then obviously, you know, I chuckle inside myself because no one wants to really acknowledge that the lifestyle, how one is living, is affecting everything.
Tremendous.
Yeah.
Tremendous.
So we have to, we'll kind of circle back around to the things that you call out in the book, but I read them and I'm like, well, of course, you know.
Right. But
And
this is your lifestyle. You know these things.
Yeah, they're
right?
basic stuff that we also have to break that model of like, there's one thing I need to do,
Yep.
there's something I need to take, you know, there's this kind of thing, but like, let's reorient ourselves, because this is muscle.
Yep.
This is ligament. The complexity, as you're talking about, and I'm kind of recapitulating my exercise physiology and kinesiology classes, the complexity of the body is so mind-boggling, right? And especially when you're talking about this inherent girdle of the what'd you call it? It's like a
hammock or a basket
like
of
a
muscles.
basket in there, and you know, the shape of the woman's is definitely womb-like, and the guys are more narrow.
Correct.
And upright, and so aside from the lifestyle choices that they can make to improve, what are you encouraged about in terms of what people can do? And then I want to kind of dispel some of the things that, you know, Kegel exercises are not understanding, and I think breathing again is a super important part of it, and understanding the diaphragm's relationship and all of that stuff. But what are some of the things you're encouraged about that people can start to do and improve this situation?
I think the first thing is these conversations. I think the fact that we are able to talk about the things like the pelvic floor, the vagina, the vulva, so openly now. I mean, these weren't conversations that we could even have 10 years ago.
Yeah.
And so I think that we're starting to recognize the importance of these conversations, and that just helps kind of disseminate this information to a much broader audience, where people didn't even know that the pelvic floor existed, yet there was help for it. I think some of the day-to-day things people can do are, I tell everybody how to pee. You know, like don't strain, don't push.
Yeah.
Sit down instead of hovering over the toilet. That helps your muscles relax better.
And also the position, right?
Right.
The position, you call that out in the book too.
Right.
And ever since I traveled around the world, I
Right.
was like, I'm not sitting. I'm putting my feet up because
Right.
and I think once you realize that position feels better,
Right.
then you're like, I'm not going to not be in that position.
Correct. And you'll
Yeah.
find any means necessary to get in that. So, so for urination, and then often I think what we do is we go pee just in case. Every time we pass a bathroom or we leave the house or get to the house, and that overtrains your bladder to empty versus going every 2 to 4 hours, which is kind of the normal range. And just basic things like hydration, keeping your urine a nice clear color, then you're having too many coffees or drink, whatever, alcohol, just making sure that you're hydrating. And then to your point about positioning, I teach people how to poop. Sit down on the toilet, put your feet on a stool or a squatty potty, lean forward, and then you can bear down and push, but don't hold your breath. Right. When I see people straining, that's what causes hemorrhoids and weakness to the muscles. And that little stool that you put under your feet puts you in a squatting position, which is the best physiological way to poop. And when I was writing the book, I was like, how did we end up on toilets? And I kind of traced history back that we used to go outside, right? Before there was internal plumbing, we used to go in the hole over the ground. And if you go to, India and Asia and other places in the world, this is still how they 100%. Defecate, is they squat over a hole in the ground.
100%.
And then we got outhouses that kept us a little warm. Then we got internal plumbing that brought people inside. And instead of having a hole in the ground, they put a chair over it. And this is literally how we ended up on toilets. And so we lost the just best physiological way to poop. So now we're bringing stools into our bathrooms to try to recreate that. Because again, the body knows best. We just created these conveniences, which are great, but have undone the natural course of things. And then I think, understanding that you're going to think this as well, but I'm like, look at your body, know what your normal is. Look at it really is how can you get comfortable with a part of your body that you've never even seen?
Right.
So I tell people how to do this in the book of using a mirror and exploring their holes and watching how their muscles contract and relax and just connecting mind to body a little bit before you dive into these exercises. So I'm encouraged because I think that pelvic floor therapy is a part of the conversation now. It used to just be, maybe some lifestyle changes, but also just take this medicine, wait until you need surgery, do this procedure, sit on a vibrating chair that does 1,000 Kegels, insert this wand that's going to rejuvenate your vagina. And we're still looking for this magic, procedure, and it just doesn't exist. They're often a waste of time, money, and hope. But if we boil it down to just some basic lifestyle changes, even how we're sitting, I'm like, if you have tailbone pain, you're probably slouching and sacral sitting and sitting in your chair. You probably have, poor posture when you're driving. You need to be upright and on your sit bones instead of your sacrum, and that can cause tailbone pain. So just these little things we're doing throughout the day. And then to your point about, what do we need to be doing in our lifestyles? I mean, I think that boils down to some of the basic things like, nutrition and exercise and movement. And people are always like, what's the best posture for your pelvic floor? I'm like, the next one, because you need to move. I mean, count your steps, do whatever you need to do, go from sitting to standing. Standing all day isn't any better than sitting all day. You just got to move, and we're just not doing enough of that.
Yeah, and now we're just, from all these, called fatal conveniences in a certain way, right? So it kind of leads us to these huge issues.
Yeah.
And systemic issues, because it's like if you're peeing a little bit, you're probably sprinting towards painful sex, or you had painful periods your entire if I had a nickel for every time I was in a relationship with someone that certainly had something. It's like if you're aware enough and you have open dialogue, you as a partner, it's super important to be aware of this stuff.
It is. And I think, some of the bigger transformative times are pregnancy and postpartum.
Yeah.
And we talked about menopause as well. And I think that I really started this kind of crusade of educating people about their pelvic floors is because what I saw happening with birth and just the over medicalization of it was transforming women's bodies. I mean, they were left with weakness. They were pushing for hours on their backs, which is not the best way to push for their pelvic floors. It's convenient. It's convenient for the medical providers. It's for the baby, but it's like, what's best for the mom?
Right.
And, they were dealing with these aftermaths of, leakage and pain and scar tissue and prolapse after birth and really feeling broken. Mm-hmm. And it was just going really unrecognized. And you can't keep having woman after woman, mom after mom coming to your office with this same story and feel like you just can't do anything about it. And so I'm like, even if we move the needle a little bit, it's in the right direction because we are just sliding into the wrong direction of over-medicalizing birth and pelvic health care and even menopause.
Oh my God. It makes me crazy.
It makes me totally crazy.
And
so much so that I wrote a book about it.
Yeah. It's I'm going to use this word, but it's abusive in the wrong, and then we assume that these providers are providing the greatest care, and it's like, and then you think about like, what's the model? Let's talk about pregnancy. So I'm giving birth and I'm on my back and my legs are open,
right,
and I'm just pushing and then you go, wait a minute, cultures, hell, they would grab a rope and lean back and and do it mostly themselves.
Right.
I'm not saying that works for every situation, but you're going, okay, so gravity, maybe water, movement. Movement.
There's just other ways. Yeah. And I think that we are getting into like, there's only one way when I think there should be options. Like we know that birth can take its own course. We know that every woman is different. We know the safety of the baby is important. I also just want to think the long-term effects on the mom. Mm-hmm. That's what I see. And so I think that there's a shift that we can make where all of those things are prioritized, right? And, I have great relationships with the medical providers in my community. They're just not educated about this. They're not informed. They were taught by another doctor who said, this is how you do it. And the hospital says, this is the most convenient way. And, and so there's just all of these artifacts that are not even always best in the evidence and or common sense that are being practiced that, again, it's to the detriment of, I think, our health.
So like if a young woman is interested in getting pregnant and maybe she doesn't have any issues, or maybe she has a little bit as she's listening to some of this stuff. She goes, oh, I have a little pain here and there. And what are some things that they can start almost preparing their pelvic floor with before they are about to put a bigger load on their pelvic floor, let's say?
So one of the things I talk about in the book is how to determine if you need to strengthen or if you need to lengthen because you have tension.
That's a huge difference.
So we talk a lot about weakness, but if you likely haven't given birth or you're not perimenopausal or menopausal, there's a good chance that you have tension. And that means your muscles are overly tight or tense. They're not relaxing well for urination or bowel movements or sexual activity or even exercise. We have this culture of pull in, suck in, tighten your core, pull in your abs. And I'm like, let it go, people, right? Just let that chill because you can't, a muscle that is tight isn't always functional. Right. We need that muscle to contract, but also relax. So just kind of folding in some different stretches and exercises. Again, looking at how you're sitting and standing, breathing. Just breathing helps relax your pelvic floor. Mm-hmm. So I'm like, if you're exercising, make sure that you're taking those breaths, doing some stretches. I list them in the book afterwards. And that you're not having any signs of tension. And during pregnancy, I would proactively do pelvic floor training. I focus a lot on strengthening the first and second trimesters when our body is changing and we're growing the baby. And then the third trimester, I focus a lot on lengthening and relaxing, teaching moms how to push, how to open the pelvis, release tension in the hips. I mean, we're going through a huge physical feat and transformation, and nobody's training us. They're like, just do what you normally do and listen to your body.
When the baby's ready, it will come.
Right.
It's like, but you can train. You can do a lot of training. Yeah.
It's a huge physical feat.
Yeah.
And we can't just tell people to do the same thing. And, they're like, listen to your body. I'm like, your body's speaking a different language. Yeah. Like, we can't understand it, and we don't know how to connect with it. So that's where I really think the training comes in, and then helping women kind of recover postpartum.
And also learning. Like we are in a different culture than how we were created. Right? So you almost have to step back and relearn. I love that part of what you've kind of shown here is the understanding of like, let's take a break here.
Yeah.
Let's look at our body. Let's understand what this is. And even if they just look at your book and go, look at that pelvic floor from these different angles. There's a lot going on in there.
Right.
There's a lot of like transverse and connected, like it's a lot going on. And so to understand that, and then as it relates and I love the lengthening side, because something that was very powerful for me is that understanding of lengthening, like actually lengthen the rib cage off of the pelvis and almost take a breath, not a breath in, but suck in and just allow that space, because we're crushed
all day,
all the time.
I mean, if you think about how we sit, how we, tech neck and rounded shoulders and, tilted pelvises, I'm like, we are rounded all day. Mm-hmm. And then when we don't even realize that, it's like our pelvic floors can't move and function. Our diaphragm can't, contract and open up our ribs. I mean, it just affects so much of what we do. Or, simple things like we're carrying a bag on one side or a baby on the other side, or crossing our legs and turning to our computer. I mean, just these little bitty things that we're like, oh, I didn't realize that that's what was a piece of the puzzle. Mm-hmm. And I think that, when we talk about pregnancy and birth and kind of the transformation that takes in our bodies, those effects are long lasting. And one of the questions I get is like, well, is it ever too late? Like, what if I had my kids 5 years ago, 10 years ago, 30 years ago? I'm like, it is never too late. Right. It is never too late to learn about your body. It's never too late to work on your body. And I think you're going to feel incredibly empowered by taking some of the ownership over this part of your body that you didn't even realize you had, because we've just never been taught about it.
Yeah. Well, you're in physical therapy. Like, it's, if you learn about something and then use it properly, the resilience of the body is phenomenal. It'd be like, okay, you learned how to do a bicep curl, and then you didn't do anything about it. Right?
But you want really strong biceps.
But then you want big, like, or you go, okay, this is how it works. I'm going to do it. Now not only is the contraction of the muscle good for my body in the correct form and function of it, but now I'm going to strengthen something that largely I didn't even think about.
Right.
And it is in the deepest of deepest cores of my body. So of course it's going to support you. Right. It's going to improve probably your digestion. It's going to improve your flow of all of the holes. It's going to
better sex, better orgasms, better, bladder health, working out for longer, running. I mean, it's everything. Yeah. It's really, arguably to me, it's the most important muscles in the body, but that's, I'm clearly biased. Yeah.
It is, listen, that is not a bad argument, because it is around the thing that moves all of life forward.
Right. Good point.
Like that it's the basin of all of it. And if we can improve the experience of our life in terms of from our periods to our functions, to our birthing, and even to later years in the menopause years, if that can be improved, if there was a pill and it's just the awareness of it to then understand this area that you didn't have any understanding about.
Yeah.
You would take that pill.
Right. You know, it's interesting because I think that there's two things I think of when you mention that is, one, there's actual research to show that 1 hour of pelvic health education, 1 hour, can improve your symptoms by 30%.
Just
education. Just teaching people how to pee, how to poop, what their body's doing.
Wow.
I mean, like 1 hour.
Wow.
And we're not giving people this, right?
Wow. It's not even offered.
It's not even offered.
Right.
The second thing is that...
unless you're the Vagina Whisperer.
Unless you're the Vagina Whisperer or you buy the book, right? I think the other thing is we're talking about a lot of these issues that affect women mostly later, but you know, outside of periods, we see a lot of childhood issues as well. Like I had a friend call me just the other day because her kid is extremely constipated and he's, you know, having accidents in school. I mean, this is a middle school aged kid, but we're not looking at how kids are moving and eating and pooping, and because we don't know how to teach them. I'm like, is he putting a stool under his feet? Is he scheduling time to go every day? What does his diet look like? Are you doing an abdominal massage to his belly? Like, teach him how to bear down properly. So just these things, we see them actually start quite often during childhood. Over 40% of female athletes in high school and college leak urine. Never having even had...
In college?
In college. Female athletes.
Whoa.
Because you think about running, volleyball, cheer, dancing, a lot of these female-oriented sports where there's a lot of high impact, and they're peeing, they're leaking, they're not talking to anybody about this. Right. So these things are happening, and yet there's such an opportunity for us to just educate people earlier, get pelvic health therapists into schools and campuses and student centers, and you know, even teaching parents. I think if we teach, again, ourselves, our generation, we can change the next generation and how they care for their pelvic floors.
Yeah, we have strength trainers.
Right.
Why don't we get a little deeper into that conversation?
When I was watching the Olympics, I was like, they need a pelvic floor therapist on their team. Because
can you spot physically how someone moves? I'm just curious.
Sometimes with runners, or like if I'm looking at how someone's running and their hip alignment, if I'm looking at how one's squatting and their knees are turning in instead of going out, I can be like, oh, they've got tight adductors, they've got weak hips. So looking at movement patterns of people, you can.
I'm curious, like the somatic side of things.
Yeah.
Like, what do you find? Is there correlations between abuse, sexual abuse, other types of abuse, and this is such a central piece of things. What are you seeing with that? And maybe it's also shame cycles and cultural cycles that are kind of also piling this on.
Yeah.
How do we aside from having the conversations, what are some of the things you're seeing around that somatic side of things?
So unfortunately, it's not that every person who has experiences sexual trauma or abuse will develop a pelvic floor issue. Right. But there are a larger number of people who have pelvic floor issues who've experienced sexual abuse or trauma. So it is a risk factor, which is incredibly unfortunate. And again, I think even when we're, treating individuals who've had or working with them, we don't really talk about the physical effects. We often talk about the psychological or the social emotional, but we see this manifest in the pelvic floor. But it's not even just sexual abuse or trauma, it's trauma in general. There was a study that watched women and they hooked up electrodes to their upper traps and their pelvic floors. And they showed them different visual videos on a screen. And even the videos that just had violence, it was not sexual violence, but it was violence, activated their pelvic floors and caused tension.
Wow.
So just watching something traumatic or that our body interprets as traumatic or dangerous affects the tension in our pelvic floor. Wow. And then think about the society we live in. Like if you watch the news, I mean, how many of us have TMJ pain, headaches? That is same tension and overactivations happening in our pelvic floor just unknowingly.
God, that's huge.
I know.
That's huge. We're so aware of you can ruminate over something and it can cause stress. But then when you're in an unsafe environment or you're watching something or you're whatever, all of that is perpetuating this
dysfunction. Right. And so that's one of the things I think is important is that the physical piece, the physical therapy piece is really one piece of this.
Right.
And that's the piece that I obviously know, have the most experience. with and know the most about, but it is a lot of pieces of the puzzle. And I often work with other providers, nutritionists, dietitians, therapists, acupuncturists, body workers, that there's a lot of kind of excavation that needs to be done when we're dealing with a more complex trauma issue.
Well, it goes hand in hand. You oftentimes when you're dealing with, because I dealt with a lot of, we were talking a little bit about my exercise therapy days after college, and I was shadowing this physiologist, and we deal with, oftentimes people had an event, like they were in an accident or something, and you'd watch their movement patterns, and then you'd do some releases on that, and inevitably there could be instant crying or what, like the body is a harbinger, right? And so, but I don't believe it's 100% just therapy. It's also through the body.
Right.
So that's why I like the physicalized side of it that you're talking about, because it's starting with, I'm acknowledging something, I'm looking at something, I'm perceiving something that I was just blowing off and expecting to work.
Right.
And it wasn't working. And so by moving with it and using it, it's naturally an opportunity for maybe nothing does come up, but maybe there is shame and sadness and trauma that comes along with it. Great. Up and out.
Right.
Find a way to get support if that is occurring. But to not do anything, and then to just have a life of, continuing to suffer when you can actually do something about it, I think is huge.
It's huge.
What do you, I think, as we kind of wrapping up here, what's kind of like your takeaway here? Like, what do you really want people to know? Like, if you could change society in this way, what would be your approach to educate, support, inform, make available? What would that look like?
I would make pelvic floor therapy as commonplace as going to the dentist. When you were young, you go for routine checkups. They teach you how to take care of your teeth. You have a daily practice of hygiene. You go in regularly for checkups so that when a problem occurs, we catch it early. It doesn't become chronic. And we educate parents, we educate kids about how to take care of this oral part of our body versus this other part of our body that, again, is so important. And I know a lot of people don't like going to the dentist. I love going to the dentist. I'm a rare bird. But I think it's just an example of how something became integrated into our healthcare model. It's covered by insurance. It's commonplace. There's no shame. And it's just because it's just a part of our body. Yeah. But if we want our teeth to last us the 70 and 80 years that we're living, we have to take care of it. Right. And I find the same thing with the pelvic floor, that if we only get one, it's going to go through changes. How do we prevent these issues from arising, and how do we address them really quickly so they don't become chronic and long-lasting? That would be the change that I would make.
And my big takeaway from this conversation is many, but the fact that you can do something right now.
Right now.
And it can make pretty powerful, because you and I have seen stuff, right? When you actually turn into something and do something about it, the body is amazing and resilient. I'm stoked that whatever spark popped for you to focus, because obviously physical therapist and all of that stuff, you can go into almost anything.
Right.
But this is a, for lack of a better word, this is an elephant in the room of a lot of situations that can be curbed and changed and transformed and improved.
Right. And I love it. And I always say, I'm not a rocket scientist. I'm just a physical therapist, and I work with muscles. Yeah. My muscles just happen to be around the vagina. So it's really, that's pretty much what it is, But I think if we really just think of it that way, it really is just muscles, and it's not weird and it's not shameful. It's just our body. Yeah. And I think if we really kind of break it down in that way, it just makes it so much less mystical. Yeah. And I think it just makes it so much more approachable that this is I'm just treating my body. I'm just taking care of my body. It doesn't have to be kind of such a foreign or shameful thing to do.
And there's a lot you can do.
Oh, and that's why I kind of go over, like, what is the normals? Nobody's even taught us the normals. Like, just start with modifying some of your normals. And they're as simple as learning how to pee and poop and breathe.
Yeah. Well, thank you for educating me a little more. My radar is widened as a result. And listen, I have done pelvic floor stuff in my life. I got to get back into the flow of it, but the stability that it creates, and it's like a hack for me. I do a breathing routine and then I do some other stuff. But you get into a lot of details around Kegel stuff, and we didn't necessarily unpack all of that stuff, and that's super important because there's a lot of contracting and over contracting and too much simplification, I think, on social media and stuff like that. So I encourage people to look at your book and understand, and how can people kind of stay in touch and maybe create this wave of vagina whispering in the world.
Well, I'm on social media as the Vagina Whisperer on Instagram, and on TikTok as the Vag Whisperer, because TikTok doesn't like the word vagina. And
of course, it's full of shame. TikTok is full of shame.
And but my new book, Floored, A Woman's Guide to Pelvic Floor Health at Every Age and Stage, you can find on my website or at any of your favorite bookstores.
I love the Floored name.
Thank you.
I mean, it's perfect. It's just, and think about it symbolically too.
Right.
It's just it's the floor.
Right.
And it's the womb, and it's a genesis of infinite possibility, and can change a lot of these things that so many women are having issues with.
That's the hope. Thank you for having me, Darin.
Yeah, thank you, Dr. Sara. Awesome.